we know that as we plan, there's not enough money.
The capacity planning could be scaled up to look after a national health insurance fund.
There's the issue of even believing that you could just tax 100 billion rand and get away with it.
Hello and welcome to the CNBC Africa special entitled South Africa's Healthcare Under the Knife. I'm Suzanne Bierkes. South Africa's healthcare sector is set for a far-reaching facelift. The first draft of government's proposed national health insurance plan is expected out in June. The market is waiting to see what this means for the 74 billion rand medical scheme industry. Will it change the structure of the industry, the number of players, or the way things have worked forever? Can this plan achieve its goals of providing comprehensive healthcare for all South Africans? Will there be a place for the private healthcare industry? And what strategies are industry players putting in place now as the deadline draws nearer? South Africa's public healthcare is failing its people. The country's burden of disease is on average 4 times larger than that of developed countries, and in most instances, almost double that of emerging economies. There aren't enough doctors, nurses and hospital beds, and around 40% of all resources belong to the private sector. It needs an overhaul. And in the next few months, government comes out with the first version of its national health insurance plan. The plan aims to give everyone access to affordable, comprehensive healthcare. We don't know what the exact details of the plan are yet, but we do know in 5 years' time, we could see a very different healthcare picture. And for the private sector's 114 medical schemes, the picture is expected to be a lot less, well, overpopulated.
I see the private market shrinking in terms of the medical scheme numbers. And I think they should rather consolidate and become a body that is not just like ordinary business that sells commodities out there.
There are around 7.5 million people in South Africa who are covered by a medical aid. But there are over 100 medical aid companies. Financial services company Discovery listed on the JSE back in 1999, and it runs the country's biggest healthcare fund. It's got over 2 million people on its books and has out-trumped competitors through its innovative strategies and by reinvesting in its technologies.
There's too many schemes. The industry is too fragmented, which means that companies like Discovery actually spend more on capex in their call centers than some of the small players making revenues every year. So Discovery, instead of making huge profits, they are a profitable company, but instead of being short-sighted, they actually used their scale to build a business that is technologically very advanced. I mean, I would go as far as saying it's one of the best medical schemes on the planet, and never mind in Africa.
While Discovery may be the leader in the open market, which is basically individuals signing up for a medical aid, Metropolitan dominates the closed or corporate scheme space with a market share of 60%. It's also the biggest administrator and has the golden goose, the civil servant contract called the Government Employee Medical Schemes, or GEMS.
It grows at about 600 families per day, and it's just over 462,000 principal members in the fund currently. So it's an exciting fund, and it was a startup by government as an employer, which makes it even more exciting. And about 40% of the membership in GEMS are people that were not previously covered by medical aid.
Currently, Discovery holds around 8% of the closed medical scheme market. The recent recession forced many of these company-run medical schemes to cut back on costs, and Discovery has been there to pick up these clients through its army of brokers, asking no questions.
We've seen the fastest rate of growth we've ever had. The fastest rate of growth we've ever had in Discovery's history in the health side, in both the closed scheme market and the open scheme market. Because I think what's happened is the environment has got this issue we were just discussing about sustainability and affordability has got so complex that I think many of our smaller competitors have just not managed to deliver and invest in the kind of technology and the structures needed. And so we're finding companies coming to us in huge numbers on the open scheme side, and on the closed scheme side we're doing a huge amount of business of companies of considerable scale that are taking their own medical scheme and putting it effectively onto the Discovery Health chassis.
But Metropolitan says it's not intimidated by Discovery moving in on its territory.
The market has sort of centered itself into administrators that are predominantly open scheme administrators and those that are predominantly restricted scheme administrators. In the future, I think the natural direction is for both of us to venture into each other's markets. And so we expect competition. It keeps us sharp. I think we need to be mindful that just because we have some dominance in one area that we shouldn't become complacent. So yeah, we're watching it with keen interest, but we are also interested in growing a business in the open scheme market. So I guess it's almost a tit-for-tat situation.
Analysts and industry players are expecting a lot of consolidation in both the open and closed medical schemes industry, for a number of reasons. The most significant is government's proposed National Health Insurance Plan. Although the details of the NHI aren't out yet, the central premise of the plan envisages the creation of a single payer fund by way of an NHI authority. This fund will receive contributions, pool resources, and buy services and products for the entire South African population. Funding will be sourced from a combination of employer and employee contributions and existing allotted government healthcare funds.
The government's put forward a few fundamentals which I don't think will change even when the white paper comes out. And those are that there's going to be an earmark tax from payroll, and it's going to be between 3 and 5%. And that there's going to be cross-subsidization as a result of that, both risk cross-subsidization, that means the healthy and young are subsidizing the elderly and sick, and income cross-subsidization, that means the higher you earn, the more you pay, and you cross-subsidize the poor and indigent. The second fundamental is that there's going to be a single purchaser model. That means that the NHI agency, or whatever the kind of agency it is, will negotiate prices for the entire NHI fund, or NHI system rather. Medical care will be free at the point of service, which implies a prepayment method, which we've just spoken about, because that will be earmarked tax. That the current tax allocations to healthcare will be increased.